biggest risk area at the moment with the situation with our domiciliary care providers. We are working very closely with two providers that have given us notice that they no longer wish to continue with the contract, one of which we have had to intervene more swiftly because of a CQC inspection report. So the council is taking swift action to bring that service back in-house. We're also in discussion with the other provider who's given us 6 months notice about also bringing that service back in-house when the contract ends in February next year. What this is showing is that the existing domiciliary care contract is very fragile at the moment. As members I think will know, we pay one of the lowest rates in the whole of the east of England. And with pressures in terms of the demand, the number of double-handed packages, and also things like the national living wage for next year, the number of providers are coming to us and saying that the contract is no longer viable. So it is our intention to bring back a payment in the new year to look at re-procuring the whole service. But we are having to take some sort of urgent action immediately now to address the situation with one of the home care providers that is literally effectively we have to take it back within a couple of weeks, and then the other provider that's given us 6 months notice will be having to bring that one back in-house early in the new year as well. But now we are going to have to quite radically rethink about how the whole contract operates. We are going to have to think about the price we pay for next year, because the national living wage uplift will mean immediately a 10% increase in terms of providers' costs. And we will have to address that somehow, and put in a proposal to the Director of Finance about how we might fund that for next year as well. So it is our most serious risk area that we're facing at the moment.
Okay, and can you be assured that the people that are currently receiving domiciliary care won't receive a loss of service, or is that inevitable that there will be a slight loss of service?
I think the next couple of weeks will be quite difficult because, as I say, one of the home care providers, we're literally having to bring back the service in-house within a very quick period of time, within literally a matter of days. I've had members of staff working over the weekend and long into the evening to actually match up the care packages with effectively we've had to expand our bank to give us enough in-house staff to cover that. But we need to transfer back within a space of about a week 80 packages of care from one of the care providers that effectively we no longer had any confidence in. So I can't give you an absolute guarantee on that, but that is what we're working to achieve.
Councillor Barbara.
I'd like to put on record, Chair, my thanks to the adult social care team and members of staff who have been absolutely extraordinary in all hands on deck, or all hands to the pump, over the last week. We've had members of staff, fully trained of course, who work in the office, going out and helping, driving around people to cover, to ensure that we can cover the service that should be provided. And I have to put on record again, Chair, that when you reduce your budget per person from over £1,500 per head down to just over £1,000 a head in 5 years, consequences are that services are very, very challenging and difficult, Chair. I just wanted to put that on record.
Yeah, thank you, Barbara. I think we all understand the challenges and the pressures that we're all under.
Can I just ask one question?
Yes, so that's good.
I think obviously, as you said, it's a very desperate situation. But how many people are actually affected by that? You said 80 packages. But obviously these are the people who actually are in dire need, really, who are given this home service as such. So I'm just wondering how many people in total are being affected by that.
Well, this particular provider, who we have given notice to, there are just 80 packages of care that we are having to take back in-house. The other provider who was given us 6 months' notice,
Yeah.
again, this obviously changes, on a weekly basis with people coming out of hospital and packages, but we're talking of around about another 250 to 300 packages of care with that particular provider. In total, we provide a service for around about, again, at any one time, it does change. Some people get, daily, some people just once a week, so, there's a range of support that people get. But round about between 500 and 600 people across the borough at any one moment in time.
Thank you, Roger. You say you have a report ready for us in January?
What I was going to suggest that in the new year, I don't know if it'll be January, but as I say, we really need to, I think, quite radically think of how we might want to redesign the existing home care service. That might well be a range of things about people having more direct payments, about moving to a patch-based system, how we can think about a high tariff and a low tariff. So I think we want to sort of bring back a paper at some point that remodels and reshapes the whole area. It might not be ready for January, but sometime early in the new year.
Okay, but you'd be happy to come and give us an update in January where we are then after the Christmas period?
Yeah, definitely.
Okay, thank you. Anything else? James?
Yeah, just very briefly, Chair. If we're talking more about just the financial situation, you're talking about a retooling of how we offer the service. So that would most probably, Chair, represent a policy shift if we're talking about looking towards more independent payments. So that might be something that would warrant an actual working group underneath this committee to actually consider it fully, because we're not just considering how to patch a hole in a silent service, we're actually talking about reconfiguring the service to change the actual shape of it itself. So that would be a positive change, so it might be worth separate consideration just in and of itself. So I'm guessing that's not going to be a light piece of work.
No, I mean, we'll have to have quite substantial, I think, consultation, through Health Watch and the Thurrock Coalition and various other organisations in Age Concern, just to think about how we get that model right. Because some authorities have just gone straight over to everyone having a direct payment and a personal budget. I'm not sure that's quite the right way to go. We may need to think about, again, a different system in terms of supporting communities, different tariffs, different price rates. Do we have a geographical patch system like we used to have? So I think there are some policy matters there that we will bring back, definitely. And if they want a small member group to look at that, then that would be fine as well.
Yeah, I think that's a very valid